Hi, my name is Dr. Serena Orr. I'm a pediatric neurologist and headache specialist at the Alberta Children's Hospital in Calgary, Alberta, in Canada. And I'm a clinician scientist that does a lot of research on migraine, and particularly in kids. So today we're going to be talking about the relationship between weather and migraine. It's a very interesting topic that we talk a lot about in clinic and with the media, so I'm excited to chat with you about that today. The relationship between migraine and weather is still something we're trying to work out, but it's true that, depending on the study, anywhere from half to 75% of people living with migraine do report that weather can trigger their attacks. And how that happens in the brain is still being worked out and probably depends on the weather change that we're talking about. So specifically with barometric pressure, that is one of the triggers that we see more commonly coming out of studies, not just studies where people are saying what they think triggers their attacks, but even studies with diaries that are linked to weather changes. So there's probably a real relationship there. And what's happening in the brain is a bit unclear, but some research in the last few years, particularly looking at animal models, has shown that if you put mice in a chamber where the barometric pressure drops, that actually leads to activation of this part of the brain in the stem of the brain called the superior vestibular nucleus. And that area then sends signals to the back of our brain in an area called the cerebellum, which has connections back to an area of the brainstem where the pain signals with migraine actually come in. And so the hand-waving explanation for that, based on what we're trying to understand about the pathways, is that a change in the barometric pressure is sensed by our inner ear kind of areas in the brain that then feed back to the pain areas where the upcoming migraine signals are going. So we think that the change in barometric pressure can increase the pain signals, as there's a kind of a direct pathway there. For other weather changes that have been linked with migraine attacks, it's a different answer. And again, it's a little bit hand-wavy. If we look at sunlight, that is another thing that's commonly reported as a potential trigger. So very sunny days. That may be one kind of a symptom of the prodrome of migraine before the pain starts, where the brain becomes more sensitive to light. So it may not actually be a trigger. Or potentially, in some cases, sunlight could trigger attacks because there's cells in the back of our eyeball in an area called the retina, called intrinsically photosensitive retinal ganglion cells. It's a huge mouthful. Those cells receive signals of light and send those signals back to an area in the middle of the brain called the thalamus, which is a big relay center, where, again, migraine pain signals come in. And we think that there's crosstalk between those light signals and the pain signals, again, possibly meaning that the brain, if it's exposed to a certain kind of high intensity light, might become better at transmitting those pain signals through. And then the other big weather pattern that we see as a potential trigger with migraine in the studies is an increase in rainfall and precipitation and humidity. And there, it's still, again, unclear why it may kind of trigger. But generally speaking, and I'm not a meteorologist, when we have more precipitation, we have a drop in barometric pressure. As you think about like the clouds that are up in the sky, if they're under less pressure, they can drop more water down onto the earth. And so again, that rainfall precipitation might be related to the changes in barometric pressure we chatted about just a minute ago. So none of this is 100% clearly worked out, but I think we're starting to have ideas of how weather patterns might, trigger more attacks for people living with migraine. The brain has an ability, we think, to sense changes in barometric pressure through our inner ear system. So the inner ear system has this little relay center at the bottom of the brain called the brainstem, and this area is called the vestibular nucleus. So drop in barometric pressure, we think, is sensed by the inner ear and transmitted to that kind of relay center in the brain that's responsible for that. And then those messages go to the back of the brain, the area called the cerebellum, in a particular area called the vestibulocerebellum, vestibulo for the kind of inner ear system. And that area then crosstalks back to the thalamus, which is our sensory relay area higher up in the brainstem, where the migraine pain signals come in. So it's kind of this little pathway that has a few steps, but we think that the change in the barometric pressure leads to inner ear activation. Those nerves transmit signals through a pathway that then has some crosstalk and influence on the pain signals. It's like everything with migraine. So migraine is not a simple here goes to there, and that's the end of it. It's a brain network disorder. And so we see kind of involvement of this network involved in sensing our body position and also likely changes in pressure, cross-talking back to the pain system. A lot of the older studies on weather and triggers and migraine would just, ask people living with migraine, what do you think your triggers are? And then report that. But now that we have more technology and we have the ability to have electronic daily diaries, some of those studies that have come out where people actually every day fill in what they've been exposed to, say whether they've had an attack, some of those studies have shown that things we think of as triggers and what people think are consistent triggers for them are not as consistent as when they just kind of report it. So it is difficult to know. And there can be some bias in that because, if I've decided that every time the barometric pressure drops, I'm going to get an attack, then I may actually, when I look at the weather and see that's happening, start to be anxious, start to feel stressed, and that anticipation of the weather change could in and of itself contribute. So it's hard. But if people really want to be accurate about their triggers, what we usually recommend is that they do get an app where they can fill out, daily diaries. Some of these apps are able to link back to weather patterns, and sometimes it's just more kind of direct entry. But if you fill out an app for a long period of time, usually we think at least 90 days of data is required, it can give you more of an objective sense of what your actual triggers are. And one thing to keep in our minds is that it's usually not here, like my triggers are, these two things and it's always that. So we did a study looking at stress as a trigger, which is one of the most common things people associate. And it really wasn't consistent even within a person, whether stress was like a consistent trigger. So only about 30% of people had stress kind of rising before at least half of their attacks. So it's important to get that data and understand also, the way we think about migraine is that it's not just one or two things. It's that combination of a variety of things that may set off the balance and the routine that the brain's detecting. The first area of the brain to light up in migraine attacks is the hypothalamus, even before the pain. And so we think that's a key area in setting off attacks. And that's what we call our basic homeostasis center. That word just means our basic control center for all things like that we need to survive: sleep, hunger, thirst, temperature regulation. So the way I like to explain it to the families I see is, if there's too many things changing internally or externally, whether that be stress, weather, sleep patterns, skipping a meal, it may not matter exactly what the trigger is, but it's just that area of the brain is not happy because there's too many things that are kind of out of routine. I'm not aware of any data in the literature or even just from talking to patients in my role as a clinician that clearly shows that, okay, if this is going to be a weather triggered attack, the symptoms will look like X, Y, or Z. I think that it's typically just, the same type of symptoms that the person will have. And determining that it was due to weather is something that, like I said, you kind of need to have observation over time, ideally with diary data. So there isn't really a way that I'm aware of to know kind of this was a weather attack versus something else. So yeah, I guess the answer is not really, but if you have the data and you really see a relationship in yourself, there may be ways of kind of anticipating and responding to weather changes that are coming. There aren't any studies that have looked at anticipatory treatment of migraine attacks in response to current or incoming weather changes. But I think that would be a big contribution, especially where I live. I live in Calgary, and we have these big Chinook winds that blow in, and there's a lot of questions that we get about that. But if we extrapolate from, emerging evidence looking at migraine prodrome, there's, this idea that maybe we could eventually look at treating during a weather change or anticipating a weather change and prevent attacks. So the kind of seminal study in the prodrome world is a study that was done in 2023 by Dr. Dodick and a bunch of colleagues, looking at people that knew what their symptoms were before the pain starts. So in what we call the migraine prodrome, people might feel a little bit irritable, tired, off, more moody, more light sensitive. So people in that study that were able to reliably kind of predict that their attacks were starting were randomized to get a placebo pill or a new treatment we have called ubrogepant. And what that study showed is even before the pain started, those people that could know that their attacks were starting, the medication actually helped to prevent pain in a lot of the people. So it's a different context, but if you know from your data that you consistently have, with a big rainfall attacks, perhaps taking, whatever your abortive agent is during the rainfall or anticipating it kind of coming, it could maybe prevent attacks. It's just we don't have data to support that. And we just have to be cautious because with some of the medicines that people use to stop their attacks, you can get into a medication overuse pattern. And if you live in like Vancouver, near where I am, and it rains every day, you could get into a pattern of overusing medication. So I think it's an important question for future research. And, something that we really need to explore, because in certain areas with crazy weather, like where I am, it could really, I think, help people with migraine to know if that anticipatory treatment would be helpful. In terms of trying to look at more long-term preventive strategies for weather-related migraine, there isn't anything specific to treating weather-related migraine that I'm aware of. Again, we need more research into this, but just developing good kind of long-term day-to-day habits and a good preventive treatment plan if you're having a lot of attacks, theoretically, we think is going to help with migraine disease, regardless of whether it's weather triggered or triggered by other things. And so the kind of typical advice that we give around, trying to maintain good day-to-day habits that are regular, like we talked about that hypothalamus being the first area to light up even before the pain, and it's not being happy when there's a lot of changes happening. So regular sleep patterns, regular eating and hydration, regular exercise, and kind of nutritious regular meals, and stress management are things that we think can bring up the threshold to have an attack so that it's harder for the brain to throw you over that threshold. And then if people living with migraine are having a lot of attacks, more than one a week or really disabling long ones, talking to your healthcare provider about a daily pill or, injection-based strategies or whatever it might be. We have many preventive treatment options, thankfully, now. We think can help with weather-related attacks as well. Again, just being on something that's going to increase that threshold to having an attack should work for weather-related attacks as well as others too. We discussed the kind of basic habits and the regularity of the habits being helpful. But I think another big piece, especially for this topic of weather-related, is working on the thoughts that you have. So, for example, again, because I live here and we have these Chinook winds that blow in, a lot of the families that I work with really feel that there's a relationship between these weather changes and their attacks. And so when they know that there's a Chinook winds blowing in over our Rockies, there can be a lot of anxiety about that. Oh, the Chinook is coming. We can actually see it, even if you're ignoring the weather, you can see this arch in the sky with the clouds. And so people will look at it and be really worried that they're going to have a bad attack. And I totally understand that. We have this problem in my family, so I get it. But working on the thoughts that you're having, it's kind of like the same idea of, oh, I'm going to go to this party and there's going to be a lot of noise and lights and I'm going to get an attack. Working on the thoughts that you're having so that you're not building up your anxiety, anticipating that it's going to be terrible and you're going to get a really bad attack, we think can be helpful. Even if it doesn't, that stress management, even if it doesn't prevent the attack, it can actually make it feel less disabling because you haven't been working yourself up to it for hours, days. So in addition to all the usual things, I think working on that anticipatory anxiety, and sometimes that's as simple as doing things yourself at home, like working on your breathing and grounding yourself, or meditating, doing yoga to regulate the nervous system and bring the stress down. Or sometimes it's helpful to seek professional help and talk to a psychologist, a therapist, to learn on how to break your thought patterns. There are some apps that will give you alerts when the barometric pressure is changing or when there's major changes in weather patterns. And there's one published study, came out a couple of years ago, looking at data from one of those apps, but it wasn't telling us whether the app was helpful in managing migraine disease. It was more just looking at the data of what types of weather patterns led to attacks. And so I think it remains unanswered as to whether these alerting apps are helpful for people living with migraine who also have kind of weather triggering. I think my concern is that anticipatory anxiety piece that we talked about. But then, if we get enough information to show that treating during weather changes can prevent attacks, these could be really powerful tools, keeping in mind that we need to work on that forecasting and vicious, like our self-fulfilling prophecy concept with the anxiety. So I think we definitely need more research into whether these apps help people manage their disease better. But I think they could be really powerful and very interesting. We just need more clinical studies looking at them as a treatment option. If you know that there's a big weather change coming, being extra vigilant about the things that you can control. I always tell my families, like, we can't control the weather, but we can control our behaviors day to day. And I really want to be clear that I think it's really important not to look at this as patient blaming. None of us are responsible for getting attacks, and none of us are perfect people that always go to bed at the same time and eat perfect meals regularly. But if you know that there's a big weather change coming, I think trying to maybe minimize exposure to other things that may be triggers, like poor sleep or skipping meals, could be helpful, just to kind of, again, bring that threshold up. Make sure that you're prepared. So number 2 would be making sure that you have a good abortive treatment plan that works consistently, that you can use if you do end up getting an attack. And that's something to talk to your healthcare professional about. Number 3 would be, if you get a lot of attacks, to have a good preventive treatment plan. Again, raise that threshold to getting an attack. Number 4 would be working on the thoughts you have around the anticipatory anxiety and worrying that you're going to get an attack, and doing what you need to do to bring your sympathetic nervous system, so our fight and flight, which we go into when we're worried about stuff, down, lower to our kind of rest and digest, and trying to not buy into that anxiety and get into a loop. And then 5th would be, I think, self-compassion. I'm a big proponent of self-compassion. We cannot control everything. It's not our fault when we get attacks. And so, if there's a big weather change coming and it ends up that, you end up with an attack and it doesn't feel good, it's okay. This too shall pass, and be kind to yourself. We can't fix and prevent everything in life. We have a big problem with stigma around migraine disease in general, and it's really unfortunate. And there's actually more data coming out that stigma can contribute to worse migraine outcomes. So it's a real thing, and it's a problem. Migraine is the most common cause of neurological disability in kids. I'm a pediatric person, and so I think, first of all, just saying stigma is there, it's a problem. Validating the experience of weather-related attacks. I mean, there still needs to be more work, but we do have quite a few studies now that confirm that certain weather patterns are associated with a higher risk of attacks. And, back in the day, we just had the studies where we asked people, what do you think about weather and your attacks? But now we actually have studies with a lot of data on people that have filled out diaries and linked to weather patterns that confirm that there can be associations. Which patterns is still a little bit up for debate, and there are some contradictory studies, but I'd say the most consistent ones that come out of the literature are changes in barometric pressure or low barometric pressure. And there's even animal studies that show that drops in barometric pressure increase pain sensitivity in animals. And those are easier to do because we can put animals in little controlled environments. And so in some ways, they're more reliable than human studies. And then there's quite a few studies kind of confirming the precipitation association. So when there's a lot of rainfall, those I think are the two most consistent. And then the third would be big kind of rises in the temperature or heat has been something that has come out of a few studies. And now just kind of emerging in the last few years and also coming out of a few different studies in different ways is the kind of related but a bit tangential idea of climate change and pollutants, air pollutants. And so there's a few studies that have looked at particulate matter, like particulate matter 2.5 or 10 nitrous oxide, and how, if there's wildfires or lots of pollution in a city, that likely can increase the number of attacks and people kind of having more attacks, having more emergency department visits, et cetera. So, thankfully the research can be used to validate this association, but saying that and recognizing that stigma is a big problem overall that we really need to grapple with in our field and work on more broadly. We just finished a study that's not published yet, so I can't talk a lot about it, where we were trying to look at the relationship between our Chinooks here in Calgary as big weather events where there's multiple changes that happen, like a drop in barometric pressure, an increase in wind speed, a rapid rise in temperature, to understand if we see an association between those and attacks in younger people, because studies have shown that adults can have changes with those. And, we're starting to understand that there may be individual person factors that influence the risk of having attacks with weather changes. So thinking about the Chinook data, we're seeing less of a strong relationship in younger people. And even in the adult studies, they found that people over 50 were more sensitive than people under the age of 50. So there may be personal factors that make people more vulnerable to specific weather and pattern changes and attacks. I'm not aware of any studies yet that are looking at that anticipatory treatment, but I think that is something I'm really interested in brainstorming around and exploring, and I'm sure some others are as well, to try to look at how we can actually help with this and whether treating during the weather changes or before would be helpful. And then I think another really fascinating area that is starting to come out in little pockets of animal research and some human stuff is trying to see, we talked about earlier about what's happening in the brain that makes this actually occur. That may not directly influence treatment, but sometimes it can, because we can identify targets for example, neuromodulation-based treatments. If this part of the brain is involved, can we stimulate it to change this pattern? And it also helps with the stigma. If we can explain from A to Z, this is exactly what is happening, we have a clear mechanism. Like, this is not, it is in your head, but it's not, you're not imagining it. It's a real thing, and we can explain it. So I think, that understanding of who gets more weather attacks, how we can mitigate their impacts, and then understanding what's happening in the brain mechanism-wise, I think are exciting areas that really don't still have much going on, but hopefully we can push forward in the next few years. First, just don't be discouraged. I think one of the most important things we do in our clinics is give people hope. No matter how bad it seems, we have so many treatment options for migraine. And you may be living in an area with crazy barometric pressure swings like I am, and it may feel hopeless, and you may ask your neurologist, like I get asked sometimes, if you should move. But there's many other ways that we can try to mitigate the impacts of the crazy weather patterns and changes on migraine disease. And so talk to your healthcare provider, and your allied healthcare providers, if you have a therapist you're working with, to kind of work on those thoughts and feelings and kind of regulating the nervous system. There's many things that we can do to make it better, and don't give up. Thanks for spending your time with us today. Hopefully this was interesting. I know this is a topic that I'm very excited about and hoping to learn more about through research in the future.